Hello, and welcome back to the Feel Freaking Amazing podcast. We have a very special guest today. Ed Levitan has joined us on the podcast. And we have Dr. Lorraine Maita, who we love personally and know personally and are just delighted to have here. Dr. Maita is a hormone harmonizer. She's a detox expert, right up our alley, right? She specializes in helping you, the listener, have boundless energy, stable moods, a lean body, sharp, clear mind, and balanced hormones so you can feel like yourself again. Who wouldn't want that? So welcome, Lorraine. We're so happy you're here.
I'm happy to be here because I want to get the word out. So many people don't think that there's help out there. They don't even know what's going on in their minds and bodies.
They can't remember what's going on in their minds and bodies because we all have brain fog.
Yeah. Sometimes it's better when you don't remember, but they do know.
Yeah. Some of my teenage things I'm happy not to remember, but yeah.
Yeah.
So, okay, how'd you get into this topic? Like, is it personal? Did your mess become your message? Like, how'd you get here?
It's a little bit of both. I was a newbie and I was, a medical director in a big corporation. And this was way back when there were hardly any female executives. I probably had 6, right? And one of them came down to me, and you're going to realize I'm just out of residency, not too long. We don't learn this. Someone came down to me. She was a very high-powered woman. I had a lot of respect for her. I was just like, oh my God, she's coming to see me. Wow. But she said to me, you got to help me. I'm in the middle of giving a presentation and all of a sudden I'm sweating. I lost my words. I turned red. The men in the room, and they're all men in the room, there were no other women. They're either elbowing somebody like, look at her, or they're hanging their head in shame. And she says, I just can't live like this anymore. So I learned a lot about hormones at that time. And I used to do these roundtable lunch and learns. And, listen, I didn't even have PMS. What did I know about hormone problems, right? And all of a sudden, like, people were just pouring their hearts out to me. And I said, I need to do something. Flash forward, somewhere around the time of 9/11, I just kind of lost it. I used to live across the street from the World Trade Center. So I thought being so emotional, not sleeping, gaining weight, crying at the drop of a hat was maybe, because of all that happened. But then I said, what's wrong with me? It's my hormones. I took some progesterone and it was like the same stuff was going on in my life. There was a lot going on in my life at the time. I could cope with it. And it was like, oh, yeah, a lot of this was my hormones. And, I felt so much better. And, that's how I said, you know what? I can't let anybody else go through this. And that's why I just decided to dedicate my career to it.
What about detox? Because I know you have a big focus on detox too.
Well, I realized after doing hormones for so long, well, first of all, I spent 25 years doing occupational and environmental medicine. And whenever you go to the conferences and, we had chemicals around and I had to make sure people were safe, people weren't getting exposed, and also that they were not having symptoms related to them. And, you go to these conferences and you don't want to breathe, you don't want to eat, you don't want to drink water. You're like paranoid about, oh my God, this is it's a toxic world. And after doing hormones for a while, that were, most people feel great, right? But then there were some that, no, what's wrong? What could be wrong? Well, you know what? It was toxicity. It's just like that straw that breaks the camel's back. Your liver is doing all this work. You add one more thing, the hormones get processed by the liver and boom. Oh my God. Then I tell people it's like trying to flush a backed up toilet. All that stuff is.
I hate that visual, Lorraine.
I hate it, but you know what? People get it. Yeah. They get it, So that's really why now I don't even give hormones to people until I detox them first, because you know what? Sometimes they don't even need the hormones after you detox them. All the things.
Let's talk about that. Yeah. Okay, let's talk about that, because I'll say to people, when we kind of drill into it and they say, oh yeah, I'm having sweats. I'm like, well, tell me, are they only at night or are they during the day too? And they're like, no, it's only at night. I'm like, that's not your estrogen, that's your adrenals, right? Yeah. So you're really nailing, like, when you transition into menopause, your adrenals should pick up the slack and keep you balanced. But if your adrenals are quivering puddles on the floor and they can't do anything but keep you alive, you're going to be miserable, but you can see the signs of it ahead of time. So it's really interesting. Yeah,
and perimenopause can go on for about 10 years. I mean, mine went on for a long time. It can go on for about 10 years and you don't even know. Nobody talks about it. I had some woman come to me and said, my husband says I'm unbearable. And yeah.
Wait, did he live to tell that story? I'm just asking. Like, let's say that to someone.
Well,
I'm not saying nothing.
It's like
I can't even believe the number of men that bring their wives into me, and it's actually an act of kindness. And I'd say to them, "Are you sure she's okay with that?" And it's like, yes. And when she explained all her symptoms and how she went around for 8 years to so many different doctors, and they either dismissed her, said you're stressed, you're getting old, or wanted to drug her with like antidepressants.
I was going to say, they're just depressed. What are you talking about? All these women, they're just they have a Zoloft deficiency. That's what it is.
Well, exactly. Or they're anxious. You're just stressed out. So they're drugged or dismissed. And, when I told her, oh no, everything that you're describing to me, she's anxious, she can't sleep, she's moody, she's snapping at people, she feels bad, she's tired, she's foggy brain, right? All of that. And I said, these are symptoms of perimenopause. And you can do something about it. Well, she burst out into tears. It's like, why didn't anybody tell me that? And it's like, yeah, that's why I'm doing this. That's why I'm on these podcasts. That's why I'm blogging all the time. That's why I'm writing all the time, because she suffered for so long. And I'm sure there are a lot of you out there that are either suffering or know somebody that's suffering.
I call it the invisible pandemic.
Yeah.
Yeah, because if you live long enough, you're going to go into menopause, and there's a transition period. And do you know our next book is called Sweaty and Bitchy? Because
I love it.
I was sitting in the car. Poor Ed. I was sitting in the car one day. We have all of our kids in the car. It's dead of summer, and we're waiting to go somewhere. And Ed's outside the car, but he pokes his head in. Lorraine, to this day, I have no idea what he asked me because I was in the midst of this like head to toe hot flash. And I couldn't do anything. And our kids are in the car, so I can't, let loose with my favorite words. And so he asked me some question. I can't hear anything because my whole body is afire. And I was like, if you value your life, turn on the car. And then when he turned, thankfully, he's like a smart and kind human. And he turns on the car and the air is on and we get driving. And I'm like, I am so sweaty and bitchy. Oh, we got to write that book.
Yeah.
Really, it just came out of nowhere. So you're right. Like it really does just kind of happen. And they're just not taught in schools.
No. And I remember when I used to go into the office, I always chose my words very carefully. I'm kind, I'm compassionate. But somehow or other, when you're in that state, when you haven't slept, you're irritable, you're tired, and you're sweaty and bitchy. It just comes out wrong. And I used to walk in the office and everybody would be like, let's start. Let's get out of here. Like she's coming in. What mood is she in? Right. I mean, I felt so hurt by that because I really went out of my way to be kind and fair and, but women feel out of control. And I say it's like being in a rowboat in rough seas with no oars and you have no direction. You just bounced around and it's very sad. That's why I find my work so gratifying because people really transform. There's hope, there's help. And they all say, I got my life back, or I feel great again, or I feel like myself again, or I feel like $1,000,000. So I want people to know this transition is, it can be a smooth ride, or you can go through these roller coaster mood swings and health swings.
Yeah. And I mean, I don't know, in terms of when I see the challenges, I think a lot of women believe that this is normal and this is the way it should be. Like this is just normal. This is what everybody goes through. It's not a problem. Everybody goes through that. So that's one challenge. The other challenge that I find is when you start talking about hormones, oh my God, that causes cancer and heart attacks. And oh my God, you can't have any hormones. And that's such a barrier to some women that it just takes time to talk about what are the risks. Let's talk about the studies. What did they actually say?
Yeah.
And I always say, like, the quality of life, you got to think of quality of life, not just all these other risks that probably are not very substantiated, but even if they were, how do you want to live your life?
Exactly. And I give all my patients a synopsis of all the key studies, and it's pretty thorough, and it's pretty, people don't realize the last few years, a lot of new studies came out saying that bioidentical hormones are safer. They're safer, they have less risk, and the risk of cancer was overblown. And the press still calls progesterone, progesterone, that people don't know the difference between a synthetic and a bioidentical. They don't know that the way you take the hormones, when you take the hormones, makes a real big difference. But the risk of cancer is just not there.
Yeah,
I want to dive into this. You go, and then I'll go.
Well, yeah, I mean, I was going to say that maybe we should go through it, but the thing that for me that I found recently is really like a big thing is there's now studies showing that with estrogen, it's protective against Alzheimer's. And when I start talking about that, they're like, okay, sign me up. You're done.
Bam.
Well, also, it decreases the risk of certain gastric type cancers. In women, you say they learn to live with these symptoms. Oh, it's a normal transition, right? Well, hot flashes, they'll say, it's just hot flashes. I don't need hormones. I don't want hormones. They're not benign. They're a biomarker of risks of osteoporosis, dementia, cardiovascular disease, artery disease, and the quality of life. Women tell me like they lost themselves. They lose their self-confidence. They lose their self-esteem. When you're in menopause, things go from color to black and white and gray, and they're just like, blah. Life has no sizzle anymore. And it's so sad to hear that from people. It makes me want to cry. But, that's my job, is to transform them and give them their life back, because hormones can do that, and they're safe. And I make sure I detox everybody first. I educate them. I give them, the studies and the history of hormones, so they make an informed decision. I'm not here to push hormones on everybody. There's just a fraction of people that shouldn't have them, but even the North American Menopause Society and 20 other organizations say the benefits outweigh the risks. It's in writing, it's there.
They said it.
They said it. They wrote it. They stuck that stake in the ground. The benefits outweigh the risk over and over and over again. And when my patients see study after study after study, it's like, okay, I get it.
I want to talk about the detox part of this because, for me, this is the part that's so poorly understood for a lot of people, which is that hormones are fat soluble. Toxins are fat soluble. If the way that your fat soluble toxins and your hormones get processed is the exact same route, and it's through the liver. Yeah. And it happened. And this is my favorite thing to talk about. So phase 1, you take your toxin and counterintuitively, you make it more toxic, right? You make it into a free radical. And then you go to phase 2, where you bind it and make it water soluble, because fat doesn't dissolve in water. So you cannot pee out your toxins or your hormones until you make them water soluble. So phase 2 makes them water soluble. And then phase 3, you pee, poop, or sweat it out. And so when you talk about detoxing people first, it's so amazing to me. I'm so happy. I'm like, okay, great. Because if you have if you have hormones that you're inappropriately processing, they act like a toxin.
Yeah.
And then you get pro-cancer forming, and then it's too much of a good thing is a bad thing. And so I'm so happy that this is your approach, because it really does make sense from a physiological standpoint.
Yeah, after doing this for so long, and then seeing the results, I had to change the way I did things, and that's why I don't even accept anybody unless they will do the detox first. I don't even take them into my practice, because I said I don't. Even if you eat healthy, you eat clean, you know this, and you eat, no, because You'd be surprised. People think moving their bowels every 2 or 3 days is normal. Oh, my bowels are normal. No, it's not normal. They're coming out like little golf balls and
bunny poops.
You need a big snake every day, a big snake or a log. It's not normal to not move it out. Just again, that visual. Try to flush a backed up toilet. All that stuff that you want to get rid of is just hanging out in there, and it's getting reabsorbed. And these are the women. The constipated women get the breast tenderness and the bleeding, and they're just not.
And the fibroids.
Yeah. And they're not feeling as good. It's not like the magic pill for them. And then also the women without a gallbladder. People don't realize bile is big in getting rid of toxins. And, if you have a bad gut and you eat a bad diet and your gut bugs are going to cleave all those toxins from the bile, you're just going to reabsorb them and you're not going to feel good. And, it's unfortunate how many women get their gallbladder out.
I want to stress what you just said, Lorraine, because remember, when you go through phase 2 and you bind it and you make it water soluble, you put it into your gut to poop it out. So now if you separate the binder, it's back to being a free radical.
Yes.
A fat soluble free radical. It can't stay in the gut. It leaves, it goes back in your system, and your liver is like, oh, I already dealt with you. I got to deal with you again. So It really is this nasty hormone cycle that we got to break. So you poop every day, sometimes twice.
Every day.
Yeah. And I mean, the other piece I'll kind of add to that is you may have a great diet. You may do all the right things. And then maybe you'll have a glass or two of wine every night.
Oh, man.
And just pushing that detox to work that much harder can just put you over the edge, especially for women, for whatever reason. That women just tend to have less tolerance, and
they do.
It's just not a way to go.
Excuse me.
And that was very hard to break, especially during the pandemic. More and more people, they were not happy. It was not a happy time. They were having more wine. And, then I saw people who were very steady with their hormones, same dose, everything's hunky dory. And then all of a sudden, so wine. I'm not saying don't have any, but,
I am.
Again,
I think there's a moderation that's.
Well, here's the challenge. I don't think that 2 glasses of wine a night for women is moderation. I would say maybe 3 drinks a week is moderation for women, but 2 glasses of wine a night is way too stinking much because we can't process it. And we're dealing with our hormones and we're dealing with the toxins. And by the way, alcohol goes through the liver, phase 1, phase 2, just like the hormones do. So you're either processing your hormones or you're processing your alcohol. You can't do both. You only have so much bandwidth in the liver. So, I'm like, eliminate or significantly decrease.
2 or 3 servings a week is probably the most I would personally recommend.
Yeah, I couldn't handle that, though.
Yeah, even the literature supports that. So, it's, and then also the serving size is like,
right.
It's a thimble. It's not the glasses that you get when you go out. It's really not.
It's not a snifter.
Right.
But think about a bottle of wine has 750 calories. So if you drink a whole bottle of wine and you do that 50 weeks a year, that's 35,000 calories that you've just drunk. And for any woman who's trying to lose weight, I'm not really good at that conversion in the other direction, but I think that's about 10 pounds.
Probably.
So getting rid of that is that 10 pounds, that 5 pounds you can't lose.
So I want to go back to you threw a lot of things out there in terms of there's a difference between hormones and bioidentical hormones and the roots and all that stuff. And I think it'll be really great to kind of talk through what are the different choices so that people really, if they do decide, they can actually think they can really make an educated decision as opposed to, oh, my doctor's doing this and it's okay. Because I think a lot of things people do may not be the best. Let's suboptimal.
Exactly.
So let's just talk first about what's the difference between bioidentical and synthetic hormones. Can we sort of drill into that, unpack that first?
Sure. Well, I use the analogy, is a trans fat the same as an omega-3 fat? No, it's been changed. Your body wasn't developed to detox a synthetic hormone. So if, do you want horse urine or do you want the same bioidentical, the same exact chemical structure that your body makes? That's what a bioidentical hormone is. So it's familiar to your body. Your body's like, oh, I know what to do with this. This is exactly, we play nice together. The synthetic hormones, like the synthetic estrogen, just, think of the estrogen receptor like a bell. It's sending a signal, like the hormone goes and rings the bell. Okay, your estrogen, as your bioidentical rings the bell, it's nice. Yeah, to open the door, that's fine. The synthetic, it's just like, it stays there. It stays on the receptor and it just keeps stimulating and it doesn't really turn off as easily. So that's the difference with estrogen. There's not as many studies because what came on the difference between bioidentical estrogen and the synthetic estrogen. But there's a lot with progesterone. And unfortunately, the press always calls progestins, which are synthetics, progesterone. So progesterone, does not cause clots. Synthetics do. Progesterone does not cause gallbladder sludging. Synthetics do. Progesterone relaxes the coronary arteries. The synthetics constrict the coronary arteries, so you get less blood flow. There's big differences. And the risk of cancer, that's really what they postulate, is that the cancer risk is not from estrogen, it's from progestins. So when you look at the studies because they didn't do that many studies on the bioidenticals until recently, but when you're looking at those studies, the risk of cancer is so much lower than it is with the synthetics.
I mean, the ironic thing about the 2002 World Women's Health Initiative is that if you actually had symptoms that were bothering you, you couldn't participate in the study. They excluded you from the study if you had symptoms. So I was like, well, I mean, sure, people want to help their bones and their heart, but like most people aren't walking in saying, protect my brain. They're saying, I'm not sleeping and I can't focus and I'm having hot flashes and I have sandpaper vagina. That's what they're saying. They're not saying protect the things I can't see, decrease my colon cancer risk. They're not saying that.
No.
So that was really, I was like, wait, they excluded the women who really are the ones who are going to take it.
Right. And they waited too long. The studies show that under the age of 60 and within 10 years of menopause, that's when you get the most benefits, because after that, you've already lost your bone, your brain is already fried, your arteries are already.
Oh my God, what a bad picture.
It's bad, so it's, you can still have some benefit, but I say it's like 50-50. When women come to me in their 80s, like, look, if they're having trouble with their brain, it does help them. They do notice a difference. And, I tell them, you may not get all the wow. You may not get all those benefits because it's harder to turn around the ship than it is to prevent it. So that if you start early, the earlier you start, the better.
I have a patient who's 59 years old and still has her regular periods.
Yeah, I see some. Yeah,
and we've her FSH just got over 10. I've been monitoring her. It just got over 10. It was 11. Wow. I was like, well, you're on your way, but you're not there yet. But so I was saying to her, like, for you, I wouldn't wait too long to start your hormones because you're already 60. But you have some time because you still have the natural impact of what you had. I was just like, oh my God. And she said, my mom did it too.
So, wow. And does you do balance her with progesterone? Because estrogen, people don't realize that even in menopause, you're making estrogen, but you're making it in your fat and adrenal glands. So that's why I say women not on hormones can get cancer. Where's it coming from? It's coming from the toxins. It's this type of estrogen you make in your fat and adrenal glands is not the feel-good estrogen that's going to get rid of the hot flashes, make you sexy and juicy. It's not. So, they're under the impression like estrogen, oh, no, but they're making it. They're making it anyway.
Yeah.
And so, well, first of all, I want to just make sure you referenced horse urine. So I want to for everybody, it's Premarin, pregnant mare's hormones. So it's literally Pregnant
From there.
horse hormones. Yeah.
Yes,
So
pregnant mare.
the other challenge with synthetic versus bioidentical, with synthetic, it's a one size fits all or two sizes fits all. With bioidentical, we can actually measure and get you to what is considered a healthy postmenopausal range, not a 20-year-old range, but a healthy postmenopausal range.
Yeah. People don't realize you can't measure Premarin. There's no measure for that. You can't measure Provera, the synthetic progestin. You don't know if somebody's in balance. You don't know, that you just know by the symptoms. And, women don't, and, that's what I observed when I had that woman come down to me, like telling me, you have to do something. And I knew nothing really at that time. I mean, I could save your life in the emergency room, but, I couldn't stop the flashing. It was so funny. But, I learned a lot from that. And, there's so many nuances to hormones. And also what people don't realize is I have a lot of doctors that won't make women get off their estrogen when they go through surgery. Well, oral estrogen causes clots. So the way you give the hormone makes a difference. If you give estrogen through the skin, like I usually give it in a patch, or sometimes when someone's allergic to the glue, I'll do a cream. The risk of clots is negligible. No one can say never in medicine because, there's always, but there's not a risk of clots. So giving it early, giving it through the skin and making sure it's bioidentical. I mean, ding, ding, ding. It's the winning formula, because when I saw those other women come to me and they'd say, because I would, recommend the bioidenticals, and then they'd say, I want what she has, and because the people on PremPro were the ones who were gaining weight. They had the breast tenderness. They were always spotting. And, that's not pleasant, especially in the summer wearing white. So it was an eye opener for me. I was a young newbie and innocent about these issues. But they were serious. They were serious. And, I wanted to see women succeed, because during those days, there were only 6. In a company of 120,000, And I know I when I was promoted, I'd walk into a room with a sea of men. It was intimidating.
Have you ever had patients who can't tolerate any form of hormones?
It happens once in a while, but if they let me clean their gut, if I get their bowels moving, if I get their gallbladder working properly, and I get them balanced properly, they can. But I have had some that gave up because they didn't want to either do the testing, or they think everything's normal and they just don't want to take the time. But I have had people who, one woman in particular, I remember, she was constipated since childhood. And when I saw her over Zoom, I could see the big red rash on her face, and she was bleeding all the time, and she just couldn't stop. And it was interfering with her life. And it was so often, and she was tired and she couldn't sleep, and she was constipated. So when I got everything going, I detoxed her first, and then she had more energy. She slept better, but she did need hormones. And it took a while, but once I got her bowels moving, life changed. The clouds parted, the sun came through. She felt fantastic. But in the beginning, she had a lot of breast tenderness, and the periods were still a little bit irregular, but she's doing great now. And she goes, "Oh, I feel good. I'm good,
So what percent of people are you like, I'm not going? I mean, essentially, you basically say to everyone, I'm not coming near you until you detox. And you've alluded to the gut and the toxins. So how long does that take for people?
I do a very abbreviated version, because I can tell people you can do anything for 2 weeks. I have my nutrition coach work with them. She prepares them for a week, tells them what to expect, what things to buy. I give them a shake to heal the gut and calm the immune system down. I give them some herbals to detoxify the liver, and I have them eliminate, I call them the troublesome 10, the 10 most troublesome trigger foods that can cause inflammation. And I have them do it for 2 weeks. First week, maybe people don't like me so much. They're like, oh, a little bit irritable. But by the second week, they're like, oh, I feel better. I'm losing weight. I have more energy. I mean, that woman, her rash went away. She was sleeping better. She had more energy, and she felt a lot better. And I have that experience with people often. And then one woman said to me, you know what? This is the first time I felt good in years. And I want to enjoy this for a while before then I add something else that's new. So she's going to come back for the hormones in a little bit, but she has her honeymoon period now, but she feels great. So I do a very abbreviated version, and then a lot of people feel so good that they choose to continue it. And we add the foods back in to not limit the foods, because it takes at least 2 weeks. I mean, somebody who's really ill, I like to go longer, but to convince people to do it, I say anybody can do it for 2 weeks. And they can, and they do, and they're grateful. And, one woman took 2 years for her to do it, because that was before I was strict. And she would come and she'd say, but my hands hurt. Finally, like, she loved to play golf and she couldn't grab the golf club anymore. Her hands hurt so much. And she would get a pain in her right side all the time. So I said, will you finally do the detox? Well, she did it. And she said, I feel so good. Why didn't you convince me to do it sooner?
Right.
Right?
Definitely your fault.
Totally. It sounds similar to what we do.
I don't care. As long as they feel good, I'll take the blame. I don't care.
Yeah. I mean, it sounds similar to what we do, because essentially often when you're starting with us, we're sending you to nutrition to start to level up on your food, because there's that gap of time where we're doing the testing and you're waiting for it. So we're like, let's get going on something. So people start to level up their food and they feel so much better coming back in 6 weeks just with food, because it's so foundational.
Totally.
Hey, can I pick your brain on something?
Sure.
I looked at the dosing of the patch. The lowest patch is the 0.025 milligrams, and it's 25 micrograms. Okay. Now I'm putting you on the spot, so I apologize if you don't know anything about it. That's fine, because I didn't know anything about it. 25 micrograms is about the dose of what we give women who take the pill. There's a 20, the 25, and the 30 microgram pill. I always in my brain had this thought that the hormones we're giving women for menopause are so much lower than what we give them in their reproductive years, but they're not. They're similar. Have you ever thought about that? And do you have any comments on that? And it's okay if you haven't, but I'm just like, wow.
No, well, I do know that is the dose that can be effective for cardiovascular health. I mean, some women need higher doses. I mean, I actually have a woman on 2 patches, but it's rare. It's very, very rare. Most people, I start them there, but it's the delivery system is very different. And
yeah, with oral, that's true.
Yeah, it's very different.
And it's synthetic. So it acts differently. Yeah,
I was like, it occurred to me like, oh, wait.
You can't really compare that, but that's why I go by blood levels. But you can't measure blood levels of synthetics.
Now, speaking of that, now I have something that I want to pick your brain, and we can cut this out. But there are people that I get that put on I cannot bring their estrogen up through blood for whatever reason. And their estrogen can go up a little bit, but their estradiol will not go up. It's a small subset.
Does their progesterone go up?
Yeah.
Just not the estradiol.
Just not the estradiol. And
I have a few like that too.
So do you keep treating? Like, do you keep raising the estrogen, or are you treating to symptoms?
I treat to symptoms, but I measure in blood and in saliva and urine.
Yeah. That's
what it's always somewhere in the middle. Where's it going? Right? Where's it going? Because some of these hormones are lipophilic. So some people it just stays, but they do it's going somewhere.
Right. And their symptoms improve.
Yeah.
So
if the symptoms improve, I measure 2 ways and 2 to 3 ways really, and see where it's going. And I have had the same problem. And like one woman just kept, wanting more and more and more and more and more. And, even the pharmacy called me and said, look, I said, I'm actually doing this to teach her something, because her hot flashes are from stress. Her hot flashes, she would literally start talking about something and her whole face would get red. And but she was fine otherwise. So her hot flashes were not because her hormone levels were perfect. Her hot flashes were brought on by stress.
Which is super common.
Right. And that's why sometimes I have to measure several ways and go to symptoms. And you can't always go by hot flashes. The diet makes a big difference in hot flashes too.
Yeah.
And your stress.
So
and your sleep.
I really want to make sure to summarize so much. So detox, super important to do beforehand. And I'm going to emphasize continually also.
Right. It's not a one and done.
Right.
No.
Because estrogen can be cancer producing if you're not detoxing properly. 2, really important not to have estrogen by mouth.
Yes.
Right. And making sure that they're bioidentical, not horse hormones or artificial progesterone, which is called progestins. And really measuring the levels, not just giving people one size fits all, is super important. So if you're listening to the podcast and you're a woman of a certain age and
we're awokas,
and you're really looking for somebody those are kind of the minimum criteria, I'd say, to be looking for a provider that really, this is the minimum case that you should be taking.
I would add one more thing to that, which is test, don't guess, right? Because, and I'm talking test, don't guess, not only for your levels, but I'm more worried that they're too high as opposed to too low. Because if you feel good and you're too low, I'm like, well, as long as your estrogen isn't way higher than progesterone, I'm kind of okay, right? I'm just testing to see that you feel good, but test your bones. Test your heart.
Yes,
test,
exactly.
Test the systems. Test your detox.
Exactly.
Make sure that you can get rid of it properly. That maybe you do want to go up in your estrogen if you have bone loss, but test. Don't just take a dose. Test.
Absolutely. You want to see the end effect, and also the Dutch test. We didn't talk about that, but that's really important to understand. What is your body doing with these hormones? Are you making toxic metabolites or more benign metabolites? And just like sorting the garbage, even clean recyclables, you got to get rid of them. So you want to make sure you're able to methylate, which is another form of detoxification. Just think of it as putting the garbage in a bag so that the garbage man can take it out. Because if you don't methylate your hormones, you're just going to reabsorb them again.
I put any patient I put on hormones, I put on our product. It's called Estrabal Complete, because it helps you process your estrogen, inhibits beta-glucuronidase, which is that enzyme that separates the hormones, and it inhibits that in the gut and supports the liver. And like, if you're going to take hormones, you have to make sure you process your hormones properly. So I put everyone on that.
We're on the same page with that, because you have to check all the boxes, and that's really why I think we're different. And that's what people don't get, because they'll go, the shocking news, they'll go to the GYNs who don't learn about this. And there was Johns Hopkins did a study that most of the residency programs don't teach them about this.
I didn't learn in residency. I learned after.
Yeah, you're a GYN. Yeah, I'm an internist, so I didn't learn that either. But I figured all the GYNs learned this, but
family docs don't learn it either. Just to round it out.
Yeah, we all don't know. We all don't know, and then they think that they're going to get the same dose that everybody else gets. They're probably going to get the pill, and they're not going to measure, because I have people who left me and then came back saying something changed, but they just copied what you did and they don't know what to do now. I need something different. And we personalize it. It's so important. It's just like the difference between having that one size fits all potato sack dress versus nice couture clothing. When it fits you well, you look and you feel the best. You have that self-confidence, the self-esteem. You feel great.
You got your glow on.
Yeah, exactly. Exactly.
All right. So the real question is, where can people find you? Where can people find that information? You've got so much to teach.
I have a lot of blogs too. For 15 years I've been blogging. So it's the feelgoodagaininstitute.com. Be sure it's the feelgoodagaininstitute.com. And you can feel free to take thefemalehormonequiz.com. It's free. It's on my website. You'll figure out which hormone is the most important to work on, and you'll get some education and advice. And I'm like, get the word out. Don't suffer in silence. Don't be drugged or dismissed. It's oftentimes your hormones and the toxins.
Yes. Lorraine, you said it beautifully. Don't be drugged or dismissed, and suffering is optional. So
absolutely,
where we'll put the show notes that'll have the Feel Good Institute, Feel Good Again Institute.com. So we'll put that in the show notes. And Lorraine, thank you for being here. This was awesome.
Thank you. So much fun. You guys are the best. I listened to you and I listened to your summit, and I just enjoyed it so much.
Thank you.
The two of you together are great.
Magic.
But you're great alone. But I'll tell you, there's a little magic there.
Yeah. So thank you for being here. And thanks to the listeners for joining us for another episode of the Feel Freaking Amazing podcast. Our guest today is Dr. Lorraine Maita, and our fearless leader, Ed, joined us too, which is like awesome because we haven't seen him in a while. So welcome. Thanks for being here.